Hello, I am Dr. T.A. With me is Sister Jane, and together we shall talk to you the first aid tips you need to know concerning fainting. Greetings to you, Sister Jane. So, our dear listeners, you can find more other first aid tips on our YouTube channel and our FB page, that is TA Thinking Aid. Watch this video and enjoy it. Thank you. Welcome. So, Sister Jane, what is your first question? Okay, doctor. So, doctor, I'm asking, what is fainting? Well, thank you, Sister Jane. So, fainting is a brief loss of consciousness, mainly caused by disturbed brain functions. There are many causes of unconsciousness, and these include head injuries, standing upright for a long time, hypoglycemia, poisoning, stroke, and diabetes. So, doctor, what should I do on somebody who has fainted? Well, thanks, Sister Jane. What you need to do to somebody who has fainted is catch the patient before he or she falls to the ground and help he or she to lie on the ground. This will prevent the patient from acquiring other serious injuries that would occur if they were to fall without help. The next thing that Sister Jane will have to do on somebody who has just fainted after helping them lie on the ground is to pinch them so that you are able to see if they are able to move their eyes. Now, this is very important because it helps you to plan on how quick or what emergent procedures that you have to do on this patient who has fainted. The third thing you have to do, Sister Jane, is to try to examine the injuries or other cause of unconsciousness. Like we said, injuries to the head could cause somebody to faint. So in case of this, you might see the patient bleeding. And if that is the case, you have to ensure that you stop the bleeding in order to relieve the fainting. After trying to examine the injuries or causes of unconsciousness, you have to tilt the head of the patient backward and keep the arm at a right angle to the head. Now, this procedure that you are seeing in the picture, Sister Jane, will help to secure airways, because blockage of airways is another reason that can cause somebody to faint. Reduced blood flow to the brain, Sister Jane, is another common cause of fainting, especially in people who have stood upright for a long time. Now, in such a case, what you have to do, Sister Jane, is you have to lift the legs of somebody who has fainted 30 centimeters above the ground. When trying to help a person who has fainted, Sister Jane, ensure that if in case there are any tight clothing that the patient who has fainted has, try to loosen those clothing, because tight clothing on somebody who has fainted can block blood flow to the brain and also reduce oxygen going to the patient. Since most of people who faint from outside, you have to assess, Sister Jane, as to whether the area around is cool or not. So, in case the area around where the person has fainted is cold, try to keep the victim warm by covering them in clothing, especially if somebody has fainted outside. So, once you have done the above steps, we expect a patient who had fainted to regain consciousness. But in case they don't regain consciousness, please make arrangements to take the patient to the hospital. Also remember to take record of the full patient's condition so that it would be easy for the next healthcare to know what was done and where to start from. So, If you have enjoyed this video, remember to like the page and subscribe to the channel. Thank you.